My thesis is, in the nursing field, communication is achieved through documentation, verbalization, and collaboration with not only their patients, but also other members of the healthcare team. K and P are registered nurses from Technical Educational Institute in Greece. They discussed how important it is for the nurse to create a bond with their patient. Good personal relationships are described as the ability of the nurse to ask questions with kindness and provide information in a way that does not scare, that demonstrates interest, creates feelings of acceptance, trust, and a harmonious relationship, especially in modern multicultural society. I had the pleasure of interviewing Janet Simmons, a registered nurse in the endoscopy unit at Beaumont Hospital in Royal Oak, Michigan. In the interview, Simmons discussed how diverse her patient population is.
We have an online video chat called MARTI, which stands for My Accessible Real-Time Trusted Interpreter. This is a system for non-English speaking patients where they can talk to a live person along with the nurse and other members of the healthcare team to make sure they understand their procedure and also to make sure we know their complete medical history. In our department, we have a lot of medical terminology that patients would never understand. We have charts, forms, and pictures that we review with both the patient and their family so they all have a clear understanding of what to expect both before, during, and after their procedure.
Jacqueline Murray, a nurse lecturer in New Zealand, states that writing is a part of nurses' everyday tasks because they have to document information through written reports and papers. In the interview, Simmons stated that she talks with patients to document their complete medical history, which helps plan their course of care.
I ask open-ended questions and document a complete health history based on their answers.
As the interview with Janet Simmons progressed, she showed me a few forms that are used for documentation in the endoscopy department. Patients in this department are having procedures utilizing a scope for visualization of stomachs, colons, and lungs. The first form Simmons showed me is the endoscopy procedure record.
This involves their past medical and surgical history, allergies to medications, height and weight, vital signs, and an evaluation of any current pain issues.
Simmons then provided a detailed discharge instruction form that is reviewed with the patient and family prior to their departure. The instructions are filled out in detail by the physician and nurse and are signed by the patient before they leave. The signature of the patient indicates that the nurse used his or her verbal communication skills effectively since they have to explain the discharge instructions to the patient as well as the family. While written communication is key, oral communication is just as important. Murray says the skill of oral communication is also important as nurses generally work as part of a multidisciplinary team in clinical settings. Simmons told me that she verbalizes with her coworkers early in the shift to plan their course of work for the day. This ensures the day runs smoothly and the patient is in a controlled and safe environment.
When I work in a procedure room with the physician, I repeat his order back to him or her so that we are both on the same page while caring for the patient.
There are many different ways nurses have to communicate within their career, such as writing patient documents, verbalizing with patients and coworkers, and also working as a team with other healthcare professionals. Nurses must be able to communicate effectively not only through speaking but also with writing. Overall, good communication is essential in the nursing field and will result in quality care of the patient.